Welcome to our recurring series, One Thing in 2 Minutes. I'm ChartSpan CEO John Michael Carter. One of the least understood parts in running a successful chronic care management program is net patient churn. Net patient churn looks a lot like the churn that happens in Medicare every day, where you have patients who churn in and patients who churn out. In fact, we know that approximately 11,000 patients churn into Medicare every day and approximately 8,000 churn out. And when you think about that in regards to running a chronic care management program, you have to look at it this way. 100% of your enrolled patients in a chronic care management program that churn out are gone. What percentage that are eligible will churn in or consent to enroll? In fact, many people think it's the clinical encounter that is the challenge in running a successful program, but frankly, that's predictable. The most challenging part is the data reconciliation, eligibility, education, and enrollment of patients in the program. In fact, that portion of the program never ends. It requires a dedicated data, enrollment, patient marketing, and enrollment team in order to be successful. Let's take a real-world example and study that. Imagine, for simplicity's sake, we have 100 patients for a particular provider who are enrolled in a program. Now, at the national average reimbursement rate of $42 per patient per month, that's about $50,000 a year in annual recurring revenue. Now, let's imagine that 11 patients churn in every month and 8 patients churn out every month. Now let's also imagine that you have an extraordinary enrollment consent rate. And when I say extraordinary and assert that to be 25%, that's because I've never actually seen a health system or a practice ever achieve that level. But let's be optimistic. If you enroll 25% of your 11 patients a month, that means you'll still have a negative 5.25% monthly net patient churn. That means at the end of the year, you'll only have 37 patients left in the program, and you will have lost $32,000 in annual recurring revenue. Net patient churn is one of the hardest parts in running a successful chronic care management program. And we should know at ChartSpan, it took us 4 years to get to positive net patient churn. In fact, these are our actual numbers. Today, we're positive and are positive every month, something we're very proud of. But we also know how challenging it is to reach that operational metric. And that's your one thing in 2 minutes.